In general, for our clients, a vast amount of them choose Medicare Advantage plans, or MAPDs, and they like them because of the benefits and because they can be geared towards specific needs like dual eligibility. But the thing is that Medicare Advantage plans are pretty good, but they are not perfect for everybody. So today, let's talk about what are the main situations where maybe a Medicare Advantage plan isn't probably going to be the right choice. Hi, Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is the best Medicare option for them this AEP, or really all year round, give us a call at the information down below and we'll be happy to help them to make those tough Medicare choices. So real quick, if we want to talk about Medicare Advantage plans, we have to really understand where they are strong and where they are sort of weak. The strength of a Medicare Advantage plan is their cost and can be their benefits, as they will often include things that original Medicare doesn't cover, up to and including things like Part D drug coverage, gym memberships, hearing, dental, and reimbursement for that monthly Part B cost, and the list really goes on. But where they are not strong is going to be in flexibility, in expandability, and speediness, and that is what most of these situations would put Medicare Advantage plans on the sort of no-go list. So let's get into at least 5 situations where Medicare Advantage would likely probably not be the best for Medicare coverage. One of the biggest restrictions to Medicare Advantages, I think, is going to be the borders that are on the coverage. Because yes, if somebody has a Medicare Advantage plan and it's an emergency, they will always have coverage, network coverage, in-network coverage, anywhere for emergency services, and even sometimes outside of the country. But that is not the issue, because if you are somebody who needs to have care in one area, but also want to have care outside of the area, Medicare Advantage plans are not going to be really great for that. An example of this would be a client I had who needed an organ transplant. Now, I don't recall which organ it was, but it turns out that places like Texas and New Mexico and Arizona seem to have a much shorter wait list for those organs than California. So he was on a list to get a transplant in those other states instead of here in California, and he had chosen to enroll into a Medicare Advantage plan because he wanted a very healthy Medicare Part B reimbursement to help him put some more cash back into his budget. But what it did, ultimately, was limit the coverage he'd be able to have if he had gotten a call from any of those other states to do the transplant. Needless to say, his care manager called us, gave us an earful, and requested to switch him back to OG Medicare and get him into a Medicare supplement instead. So the long and the short of this is that if someone wants coverage or may need coverage in many different states or all across the country, then an MAPD may not be their best option for that. Another real weak spot for Medicare Advantage plans is the doctors' networks. Not that they are bad, but they are designed with a very strict criteria about when and which doctors somebody can use. With original Medicare, as long as a doctor is willing and able to take payments from Medicare, then a beneficiary can go see them and the specialist or physical therapist or all the other downline cares that they may get referred to. But under Medicare Advantage plans, specifically under the HMO model, it means that clients can only go see doctors who are contracted with the carrier on that specific plan and can only go to see specialists that are also within the same doctor's group, which means it is possible to have both a doctor and a specialist you want to see on an MAPD, both accept that same insurance plan that you have, but if they are on different doctors' groups, then you end up with a King Solomon style choice about which doctor you'd like to keep, but not being able to see both. For folks who are reasonably healthy and they just kind of have checkups every year or maybe a couple of prescriptions, the next one is not a big issue. But for folks with complicated care situations, or they are moving from under 65-year-old plans to Medicare and had previous care and doctors arranged and all that kind of set up, it can be a challenge. The main reason why care utilization is a little bit more difficult under Medicare Advantage plans than with something like Original Medicare or Medicare with a Med Sup attached to it is because, of course, of the bureaucracy. In the sense that they are looking at every procedure, they're looking at every visit, they're looking at every referral and every dollar that could be spent on a beneficiary and making a decision if it is an appropriate use of their cash to cover these procedures. Usually if there is any questions, those things get denied. So there are prior authorizations and limits to how much certain care can be had, and that can be really frustrating for folks who are trying to get the best healthcare they can, not just trying to get the one that is most dollar efficient. The number 4 situation is one that relates to the sort of kind of rigid benefit structure that Medicare Advantage plans have. And in this case, is specifically for those folks who have a large need for prescription drugs. The reason for this is that many of the Medicare Advantage plans here in Southern California also do have a Medicare Part D drug coverage attached. It's usually pretty good as well, considering it doesn't have a deductible like a standalone Medicare Part D for the most part. And it is run through the same insurance plan. So it's all sort of in one place. Where this becomes problematic though is if somebody's prescription needs to start to move away from what is available under that Medicare Part D plan that is attached to their Medicare Advantage. Since the coverage is attached and cannot be separated, it means that if there is a Part D plan that is a better fit for the client's medications needs, they're not able to jump into that plan without also losing the other healthcare coverage through their Medicare Advantage. Ultimately, this means that beneficiaries can be put in a situation where they have to choose between keeping their doctors and their specialists and their beneficial prices and other medication needs. So in a situation where somebody has complicated and changing medication needs, it may make more sense to stay with original Medicare and then get a Med Sup and then get a Part D standalone plan that allows them to move in and out and a little bit more flexibility on those drug coverages. Last up for today is more of a procedural reason rather than a situational reason when an MAPD would not be, the greatest, and it is because of the requirement to be enrolled in Medicare Advantage plan. It requires a person to have both Medicare Part A and Medicare Part B. Now, that all seems pretty reasonable because most people do not have a monthly premium they have to pay for their Medicare Part A because we all pay into it while we are working. And for the other half, that is Medicare Part B, there is a premium which goes up every single year that everybody has to pay for. But if someone doesn't have either Medicare Part A or Medicare Part B, it means that they won't actually be eligible to enroll in a Medicare Advantage plan. Now, this could be because someone still has work coverage and has not yet opted into Medicare Part B, or they are not eligible for either Medicare Part A or Part B, or they could have Medicaid and only have Medicare Part B but not have Medicare Part A. So all these situations here are situations where Medicare Advantages wouldn't be a great fit because, well, they can't get it. But important to understand is that if someone does just have Part A or just has Part B, they still can apply for a standalone Part D drug coverage to help them pay for their medications. Just a side note. All right, so that's it for today. Those are the 5 main situations where a Medicare Advantage plan may not be the best option for a Medicare beneficiary. First would be if they need or want to have full nationwide coverage. Second is a situation where somebody has numerous and varied doctors that may be in or out of different networks. Third is the barriers that can be put on a Medicare Advantage plan for getting care. Fourth is the rigidity of the drug coverage on a Medicare Advantage plan. And fifth is for those folks who don't have full Medicare Part A and Part B, they won't be eligible to enroll. So that's it for today for Michael's Medicare, and I really hope that you enjoyed this video. And if you or somebody you know is trying to work through this or really any of the other Medicare quandaries that are out there, please feel free to reach out to us at the information down below, or leave a comment, or just like and subscribe so you can get notified when our newest content comes out on the socials, on Instagram, on YouTube, because we have new great Medicare content coming out every single week. So for Michael's Medicare, I am Michael, hoping that you have a great rest of your day, and goodbye.